I want to remind you, you're watching Health This Week. I'm Don Baillargeon. If you've just joined us or you'd like to watch this program again and learn more about what we're doing, visit our website at healththisweek.com. You can also call our toll-free number at 800-213-1553. I'm joined now in studio by a good friend, Dr. Sheila Foreman, clinical psychologist, attorney, one of the busiest people I know, and we always feel so honored that you can make time in your schedule to come here on the program.
Thanks, Don. Anytime you ask, you know I'll be here.
Well, Sheila, something that we talked about before coming on the air, and I thought was a really interesting subject, you know, the baby boomers are now getting into that 55 to 65 age group, and what these people and ourselves are finding out is that our parents are living longer. They're getting into their 80s, some are getting into their 90s, and with that brings other issues. You know, obviously we'd love our parents to live as long as they possibly can. We take our parents for granted in some respect, but now other issues come into the fold, such as perhaps dementia or Alzheimer's, perhaps managed care. And I have to think that that brings in some feelings of not only sorrow and perhaps loss, but also some degree of guilt, because now you have to start thinking about what's going to happen if I can't, you know, care for them on a daily basis.
Absolutely. You know, we have a term for those of us in this situation. We're called the sandwich generation, because we're sandwiched in between our aging parents who, fortunately, are living longer, which is wonderful, we have them, and then we also have the responsibility of children and family, and we're stuck in the middle. And trying to balance that, the needs of our aging parents with our own personal needs and the needs of our growing family, can really take a toll on a caregiver.
You're absolutely right, because let's face it, 40, 50 years ago, this did not happen to our grandparents. When our grandparents got to be 55 years old, it was very likely that their parents were already gone. And of course, people 55 years old 50 years ago were done raising their families. Their kids were already gone, so they didn't have that. They were the empty nesters, I like to call it.
Right.
We started our families later.
That's right.
Our families are living longer, so that sandwich thing is really a perfect title for it.
And what's happening, too, is what we're seeing both clinically as a psychologist and what also the medical profession is saying is that the people stuck in the middle, those of us in the sandwich generation, are suffering from something called chronic stress paradigm. We're actually having so much stress that we are also getting physically ill. So it's so important that when you're trying to balance your aging parents, your family, you have to include yourself, too. It's really important to take care of yourself as much as you take care of the people around you.
We've got about a minute left, but how does someone go about doing that? Because the pressures of children are one thing, but the pressures of aging parents, you want to do good by them. You don't want to make them feel like they've been abandoned. And, you know, how do you bridge that gap?
The best way, ask for help. Get support. Whether it's a car service that can help take your kids to their soccer games or your parents to their doctor's appointments, a housekeeper, whatever you need, ask for help and support. Don't do it all by yourself. It'll hurt you.
For people going through that and they feel the guilt pains of that, they just need to get by that?
Well, guilt means that we're doing something bad or wrong. Okay. We're not doing anything bad or wrong when we take care of ourselves as well as the people around us. So with respect to guilt, it's not a word that I would encourage people to use in this context because it's really not appropriate. We're all doing the best that we can, and we need to give ourselves a break.
Sage advice again, Dr. Sheila Foreman. To learn more about Sheila, go to her website, drsheilafforeman.com. Sheila, thanks so much.
Thanks, Don.